Hello and welcome to my first broadcast. I'm Dr. Sharon Theroux. I am a licensed psychologist and I am also a certified MBSR instructor, mindfulness-based stress reduction. And I have been asked by Michael McLeod from Zubia to speak with you this afternoon because February is National Heart Month, and he had offered me this opportunity to speak about mindfulness and how it can affect heart. So I'm right now waiting for people to sign up. I see we have one person who's come in so far. This one person, if you have I see we have two. If we have texts, just know that if you have an iPhone, that I believe that you can text me. I don't know if I'll be able to read it. I'm hoping that I'll be able to read it because I've been practicing a little bit. So I see we have 5. And we're just going to wait about another minute and a half before we go ahead and start the broadcast, just to give other people a chance to download the Zubia app and familiarize themselves with that. I am wondering where everybody is from. I am broadcasting from Fort Lauderdale, Florida, where the sun is very bright and it's probably about 86 degrees outside. So I believe that that's probably different from people in other parts. I see we have one text. This is a good opportunity for me to practice. Okay. And everything looks good. We now have 8, and we've got 30 seconds left for the countdown and before we begin our broadcast. For those of you who are just joining me, I'm Dr. Sharon Theroux. I'm a licensed psychologist down here in Boca Raton in Fort Lauderdale, Florida. And today I'm going to be speaking about a mindful heart. And back, I'd say maybe a couple months ago, it seems, I was approached by Michael McLeod from Zubia about this wellness community that he's establishing, and to be able to provide people these free broadcasts on issues that are pertaining to health and wellness. And I originally met Michael when he was talking to me about mindfulness, when I was giving a presentation on mindfulness, and he thought that this would be a good opportunity, especially now in February, National Heart Month, that we can talk about mindfulness and how it might be able to improve our cardio functioning. So, but let me first introduce you to who I am and how I kind of fell upon this broadcast of speaking about a mindful heart. So I've been a licensed psychologist in private practice with my husband at the South Florida Center for Mindfulness for the past 20 years. But before I was a psychologist, I was a critical care registered nurse at a hospital. And I saw, this was back, I'm dating myself, but it was back in the 80s. And for 10 years, I was a coronary care nurse. And I saw the effects of stress and how it affected people in their everyday lives, people coming in with heart attacks and high blood pressure and stroke and diabetes. And, genetics plays a big role in the development and the onset of these diseases, but we can do much more to prevent these episodes and these events from happening if we could learn to handle our stress better. And I thought that when I was a nurse, I just kept telling myself, it just seemed such a sad state of affairs that there was only so much I could do to help people, and many people died. And that I was, I just couldn't help. And I just kept wishing if there was some way that we could prevent these things from happening altogether, we could lower the incidence of cardiac problems and strokes. And so what I ended up doing, so after working for 10 years as a nurse, I went to graduate school, and I actually got my PhD in clinical psychology. And then I began working with my husband in private practice, and I began specializing in treating people in therapy for depression and anxiety, eating disorders, and chronic pain. But in 2011, I kind of stumbled upon mindfulness. I was reading this book because I wanted to teach people how to keep from having a relapse from depression. And there was a new book that came out that for psychologists, saying this is the manual for this mindfulness-based cognitive therapy for depression relapse. So I got the book, and I'm reading the book, and it was so easy to be able to do these groups. And I thought, this is wonderful. But it said, I think in page 42 of the book, that if you really want to teach this mindfulness-based class, you really need to take the class yourself and kind of immerse yourself in what it's like to be fully mindful. So I thought, okay, so I signed up for a class. And I'm telling you, I took this class because I was a doctor to help other people. I wasn't there to help myself. But after the first class, when we started to practice meditating, and it felt so good for me. I never really knew how anxious I was until I started to slow down. And then when I started to slow down, it felt so good that I was like, oh my God, I need to help people learn how to do this. And since the beginning of mindfulness-based stress reduction, which was a program that was developed by John Kabat-Zinn back in 1979, there's been a ton of research that supports the use of mindfulness meditation for not only helping people. It was originally created for people with chronic pain, but now it's been an evidence-based treatment modality for a number of different illnesses, including depression, anxiety, but also physical illnesses such as hypertension, cardiovascular problems, cancer, autoimmune diseases. It's like it kind of cures everything that ails you. And it's just a low-tech way of helping people to prevent an onset of a cardiac event. So what is mindfulness exactly? Well, what I'd like to do is to give you a little taste of mindfulness. So I would invite you over the next couple minutes to let's get yourself in a comfortable, seated, upright posture. And so I'm just going to make sure here that I have my feet flat on the floor. I'm kind of short, so I have to scoot up on the chair. And so if you can allow your feet to be flat on the floor, your legs are uncrossed, you're allowing your pelvis to provide this stable base for your back and your upper body. Your spine is straight, but not too stiff. Your head is resting squarely on your neck and shoulders. Maybe want to getting the wiggles out a little. And then, if you'd like to, you can gently close your eyes. But if you'd like to keep your eyes open, then just looking at a stationary spot on the floor in front of you. And then when you're ready, just dropping into the fact that you're breathing. Maybe you feel the breath more vividly at the belly as it rises or expands with the in-breath and deflates against the out-breath. Or maybe you notice the breath more vividly at the nostrils, sensing the slightly cooler air coming in and the slightly warmer air going out. Wherever the breath feels more vivid for you in the next few minutes, then just focusing on that region. So there's nothing else for us to do in this moment but just be here, sensing our breath. Not so much thinking about the breath, but just feeling it coming in. Dropping out of thinking mode and just entering into this domain of being. Now, you may realize after doing this for a few moments that it's not so easy to stay focused on the breath. The mind often has a mind of its own and will wander off to maybe having a thought, like what you're having for lunch afterwards, maybe, or maybe a conversation you had with your spouse before you went to work. Whenever you notice yourself off in the future or back in the past, just congratulate yourself on catching the distraction. That is that magic moment of mindfulness when we are aware of what our mind is doing. So maybe making a mental note of what distracted you. Maybe you were planning. Maybe you were feeling tired. Maybe you were distracted by a sound. Making that mental note and then coming right back to this breath, back to this moment. And it doesn't matter how many times you come back to the breath or how often you were distracted. It was that each time you just bring yourself back with kindness. Almost like you're training a little puppy to stay on its mat. The puppy wanders off and you bring it back. And then when you're ready, taking a nice deep breath in. And on an exhale, opening up your eyes. Okay, so what I'd like to do now is to ask you, and for those of you who have iPhones that can text, would anybody like to share their experience of what the last few minutes was like for you? And as we're waiting for people to provide their observations of what happened, let's just talk about what the definition is of mindfulness. So I'm going to use the definition that Jon Kabat-Zinn used in 1979. And he believed that mindfulness is simply paying attention. But we're paying attention in a very specific way. Firstly, we're paying attention on purpose. So as we were sitting here a few minutes ago and our eyes were closed and we weren't doing anything else, we were really setting the intention to be here for those few minutes. So we were paying attention on purpose. Secondly, we're paying attention in the present moment. So remember when I said your mind wanders off and you bring it back. your mind wanders off and you bring it back to the present moment and us sitting here breathing together. So you're paying attention on purpose in the present moment. And then thirdly, and which I find is the most challenging, is that you're paying attention in a non-judgmental way. So if, for example, when I say the mind wanders off, it's just a perfectly natural thing for the mind to do. It's really good for our minds to be able to wander off and multitask in everyday life. But when we're meditating, we don't necessarily need to have that. So we just notice the mind wandering and we bring it back. But we don't judge ourselves harshly for the mind wandering when it's something that the mind just does automatically. Now, some people may judge, like, oh, I shouldn't have. In fact, that's what I did in the beginning. Mind wanders off, like, oh my God, bring it back. I'm not meditating. And that's not it at all, because the mind is naturally going to wander off. So noticing when the mind wanders off, that is the moment, the magic moment of mindfulness. And then you just bring it right back to this breath. So mindfulness is paying attention on purpose in the present moment and then non-judgmentally. So now we have a few text messages from people to share their observations. So let's see what we've got here. Okay. Okay. From Bry B, we have a response. And that response is, if I had to come up with 2 words, it would be a focused cleansing. I like that. Good noticing. Also, a response from Living Healthy. Unexpectedly calming. Thank you. And then, let's see. I have, let's see, a couple more from Sarah, I think. This is so relaxing. Is there an optimal time of day before the chaos starts? Or is there an optimal time of day to meditate? Maybe before the chaos starts or after it ends in the evening? Wonderful. The best time for me, and I think everybody can find their own best time, but for me, it is first thing in the morning. I try to go and meditate before I even open up my email, because once I open up my email, then it's always, there's something that distracts and my mind just goes, it starts, the engines are running. And then so when I sit, I have usually a pretty busy meditation, and it can be more pleasant sometimes when I'm in a calmer state of mind. So good question. Let's see. And I have another question with Living Healthy. Do you work with high school students? Good question. Yes, if you go to mindfulsouthflorida.com in April, there is a program from the United Kingdom called .B, DOT.B, the letter B. And if you go there, they talk about programs for high school students and teens from 11 to 18 that help treat people with mindfulness. And it's starting to come here to the US, and I'm going to have a training. I'm going to a training in it in April. But yes, mindfulness is really starting to come to the schools now. So yes, thank you so much for all of your noticing. And now what I'd like to do is talk about, well, all right, so we all had a little taste of mindfulness. Well, what does mindfulness, how can mindfulness affect and help our hearts? Well, first of all, let's do a summary of information I just Googled a little while ago from the CDC, the Center for Disease Controls. And according to the CDC, cardiac problems are the leading cause of death for both men and women. And 1 out of 4 deaths in the United States are due to coronary heart disease. And put in another way, which is really scary to me, is that in the United States, someone in the one person in the United States has a heart attack every 42 seconds. That's just like crazy. Now, mindfulness in the past has been really effective. A lot of research out there showing that it helps with depression and it helps with anxiety. And you can kind of get that after listening to the comments of some of the people on this broadcast, because they found it to be relaxing. And if you spent, we just did 5 minutes. If you could do 5 minutes a day to kind of bring your stress levels down, and if you do that every day over a course of years, you can just imagine how how that could affect your stress levels. And we've certainly have had evidence to be able to prove that from an anxiety standpoint and from a depression standpoint. But only recently, in the past, I'd say, I don't know, 5 or 6 years, have they really started to find data to suggest that not only does it help you feel better emotionally, it helps you reduce your depression and anxiety, but it also helps you from a cardiac standpoint. And in preparation for this broadcast, I did a lit search on the most recent evidence to support that. And what I found was a meta-analysis that was done in 2014. And it showed that in this meta-analysis, they looked for the most rigorous scientific studies that were out there. And they found 9 studies that kind of met their muster of rigor. And they found that, yes, definitely mindfulness can help people with depression and anxiety, and also help people cope with stress better and improve their quality of life. And those benefits are like moderate. You've got effect sizes that are small, moderate, and large. So the moderate effect sizes are, it's a bit of these powerful tests that some of these tests, these studies only have, 30 or 40 people in them, and yet they still have a very powerful result. So that's the psychological benefits. But now what they're finding from this meta-analysis, that it also has the ability, when we're talking about taking an 8-week class in mindfulness-based stress reduction, that's what they're using to compare people from people who have never had a meditation practice before. They put them through an 8-week class in MBSR. Now, I think it's really important for me to tell you about MBSR, because if you Google MBSR, which is mindfulness-based stress reduction, in your area, you might be able to find an 8-week class, because some people have a really hard time learning how to meditate unless they've taken a class themselves. And I can tell you, I suffered from that same thing. I could meditate maybe for 10 minutes with a guided meditation, but I couldn't just sit. Now I sit and I meditate 40 minutes a day. And I was able to do that after taking an 8-week class in MBSR. So if you want to if you're interested in signing up for MBSR, you can just Google MBSR in your city, and something should pop up, because it's now being taught in about over 200 hospitals nationwide and people in the general community. And it's really becoming a very popular and very healing practice to be able to help you deal with stress better and to learn self-care, elements of self-care. So anyway, back to this study. So they took this 8-week class, and they checked their blood pressure before taking the MBSR class, and then at 8 weeks. And they found that sometimes this, especially in people with the highest blood pressures, like blood pressures, the systolic blood pressure being in the 160s, that's the upper number, they could bring their blood pressure down as much as 20 points during the 8 weeks. Now, if your blood pressure is like 130 or 120, you're not going to see that drastic of a point drop. But they have found that they've seen reductions even at those levels. You may not drop down 20 points, but you'll drop down 5 or 6 points. And I think that that's awesome. It's just an awesome result, because you know what? You don't have to, meditation is like, you don't have to go anywhere. You don't have to do anything. You don't have to go and get your script filled. You can do this. This is a low-tech means of you being able to do it on your own. So, and I teach this in my community in Fort Lauderdale and in Boca Raton, and but there are other MBSR instructors out there throughout the United States, throughout the world, that are teaching MBSR. So Google MBSR. Now I have another comment, a text from someone. Do you find that mindfulness can help people with addictions? And the answer to that is yes. They have a program that was developed at the University of Washington called Mindfulness-Based Relapse Prevention. And it's one of these 8-week classes. And they used the 8-week MBSR class, and they really made it tailor-made for people with addictions. And I'm just so happy that you asked me this question, because I treat people with addictions. And I know the latest research about mindfulness and addictions is that mindfulness can really help, just as good as cognitive behavioral therapy, better than treatment as usual, which would be AA, NA, OA. And the treatment with cognitive behavioral therapy, it's a very interesting research finding that they found with addictions, is that when people relapsed quicker using a mindfulness-based treatment than the people that were in cognitive behavioral therapy, but they got back on the wagon sooner than those individuals who had relapsed from the cognitive behavioral therapy groups. So, and that's really all that matters sometimes when you're in the throes of an addiction. It's not that you relapse, it's how soon do you get back up on the horse. So, so thank you for that question. So yes, mindfulness has really been able to help people alleviate suffering in many, many different areas of life. And a lot of people think that mindfulness or meditation in general is to just get us to this blissful, like, serenity. That's really not what mindfulness is about. Mindfulness, and we don't want to elevate ourselves to a higher plane. We really just want to be present fully, and to be able to tolerate, to be able to accept, to be able to embrace what is going on in the present moment, no matter what is going on. And, I'll just give you a little antidote for myself. When I started this mindfulness tract, and I started noticing that I had thoughts when I'm meditating, I have these thoughts. I never really separated myself from my thoughts. And once I was able to separate myself from my thoughts, and I developed an inner peace and compassion within myself, where now it's like I'm my own best friend, and I can take myself and I can support myself wherever I go. I can be in the most volatile of situations, and as long as I have myself, then I know that I'm going to be okay. It's going to be unpleasant, but I know I'm going to be okay. And that's what mindfulness teaches you to be able to do. So those are my thoughts. Is there any other questions that people have as we close this broadcast? Okay. Well, I want to thank you all for attending. It was a pleasure, and hopefully I will do more broadcasts, and I'll let you know when those occur. Take care. Bye-bye.